Third quarter training for Benicia emergency response teams focuses on triage and emergency medicine.
The first scene is it's Thanksgiving Day, so good luck, you're on your own. Don't expect the police or the firemen to be responding. It's Thanksgiving Day, they're with their turkey, they're working their way through the pumpkin pie. You're going to be dealing with this scene, you're on your own, no help is going to be available. You know that right away. Oil tanker turned over. So you have some consideration that there may be toxic chemical there. At the same time, there's fire, there's smoke inhalation. So directly this scenario gives you some idea of what type of injuries you're going to find among these 5 victims. And numerous casualties have occurred during this event. So someone is going to come up here and demonstrate everything we just learned about megacode.
Hey, can you get me out of here? I'm a lawyer now. I got things I need to do. You got to get me out of here. You gotta get me out of here. Hey, hey, come on.
Is this, are we at?
We are doing this. Yep, you're right here.
I'm a lawyer. I have things I have to do. I don't need to be in this mess.
I think I need
my
to
arm, get me out of here. Now look, you gotta get me out of here.
My arm hurts. My arm hurts. I'm bleeding. How would you find that out?
Okay, so right away you ask anybody here who can hear my voice and respond to me, come and help me. So right away you announce, anybody here who can hear my voice and who can walk to me, walk to me. So right away, go ahead and do that. Call out.
Is already charged up.
Right, so you approach the scene. As soon as you approach the scene, you say, anybody who can hear my voice and walk to my voice, walk to me. Go ahead and do that.
Even though I'm distracting you.
Okay.
Yeah.
Hey, can you get me out of here?
My voice,
can you get me out of
me?
here? I'm a lawyer. I don't need to be involved in all this mess here.
And
Come
you're
on.
talking to her as
Hey,
well.
now look.
Can you walk?
I can walk just fine. Just get me out of here. I have things I need to do.
So now you have somebody to help you.
Okay.
So
get me out of here.
I'm tagging her green.
Very good, excellent. You've tagged her green and move along.
Now look.
My arm hurts.
What the hell are you going to get me out of here?
I'm bleeding. My arm hurts.
Now look, I got to get out of here. I got to get out of here.
So you ask your buddy to tag her with the green, and while they're tagging her with the green, you move on to the next scene.
I'm bleeding. My arm hurts. My arm hurts. I'm bleeding.
You're going to get me out of here, right?
So we have a rescuer who's standing here, and he's surrounded by victims.
Right.
She's calling out for you. There's somebody lying over there. You start triage. You start triage where you stand. START stands for simple, triage, and rapid transport. So start triage where you stand. The closest person to you is this lady. You walk up to her. Read what it says on there.
My arm hurts.
Read her tag.
I'm bleeding.
You walk up to her tag, and her tag says that her clothes are black and covered with soot, and she has a strong burning smell coming off of her clothing. She's complaining of pain in her arm. So you ask your buddy to bring you a mask and some goggles. You put on your safety equipment. Very good. And the victim is saying her arm hurts. She's telling you that she has pain in her arm. So you know that if she's complaining of pain in her arm, she probably has a fracture or a strain or sprain injury to her arm. She's also covered in black, so she may have a smoke inhalation injury. She may have trouble breathing. She also seems to have burned clothes, so she may have burns on significant parts of her body. So she may go into shock as a result of her burns. So now you're dealing with this victim. You've quickly identified her injuries.
And she's sitting down, correct?
She's sitting down at this time. She's hanging out of the truck. She was the truck driver.
Okay, well, if she's in shock, I need to check for that, correct?
How, very good.
Okay. One way of putting it, of course, is the capillary.
So he's saying capillary refill, and he's watching for the color to return quickly to press your fingers.
All right. The capillary refill is adequate, less than 2 seconds.
And he's looking at her breathing.
And I'm moaning. I'm hurt. My arm hurts.
So she's talking to you. That means she has no airway obstruction. Good.
Right. And she can walk.
She can walk.
I could say, can you walk? Stand up, walk.
I don't know. My arm hurts. My arm hurts really.
All right.
Okay.
Maybe my assistant will help you.
So she's not in shock. So it's okay to get her up on her feet and let her walk. If she was in shock, you would want her to lie down and elevate her legs. But she's not in shock. Right, she's extricated successfully from the truck. She was the driver of the truck. You've extricated her. You've assessed her for shock. She's able to walk. She complains of pain with her arm. You need to make a splint for her arm so that she can be able to, at this time you can splint it against her body and just get her up and move her away from the scene. And there's no response.
There's no response. I can try and roll her over on her
Very
back.
good. You use your buddy to help you to roll a person. One person assumes control of the head and the neck, and the other person assumes control of the shoulder and the hip. And in this fashion, you turn a person over as a log in one unit. So on the count of 3, we're going to turn her over. One will hold the head and neck. The other will hold the shoulder and hip. On the count of 3, 1, 2, 3, we're going to turn her over. One holds the head and neck, and the other holds the shoulder and hip. And we're going to turn her over. Very good. Be very gentle when turning people over. You may cause a secondary trauma by rough handling.
About untangling the stick in the face.
Yes, it's okay. So you go ahead and you turn her over, and after you turn her over, you try. Scoot over, Rena.
Okay, now I'm checking for the respiration.
Very good. How will we check for respirations? We're going to do the look, listen, and feel. We turn our face on the side. We're listening with our ear. We're feeling for breath against our cheek. And with our eyes, we're watching the chest and abdomen to see if the chest and abdomen rise and fall. She appears to have no respirations at all. What should we do next?
She is breathing.
She's not breathing. So now we're going to try to restore breathing. We're going to do a head tilt, chin lift. We put one hand on the forehead and tilt the head back. Put one hand under the chin and tilt the chin forward. You can use your fingers to open the lips. We do that, and at the same time we do a look, listen, and feel. We're look, listening, and feeling again, and we still see no movement of the chest, no movement of the abdomen. We don't hear any breathing feel any breathing against our cheek. So what do we do now? We make a second attempt. You always make a second attempt. Make 2 attempts to rescue breathe. If you, with your second attempt, you still don't have any breathing, now you're going to go ahead and tag her. What color will you tag her? Black. You can do one more thing before you tag her. You can feel for a pulse and check capillary refill. You can feel for a pulse in her neck, or you can feel for a pulse at her wrist, and you can do a quick capillary refill. She has no pulse, she has no circulation, she has no perfusion, she's dead. You've tagged her as black, and now what are you going to do? Your buddy is tagged her as black. You move on from the scene. You go to the next one closest to you. Some moaning sounds. She has some breathing, but it doesn't sound like a very normal type of breathing. It looks like she may have some problems with her breathing, even though she is able to make some sounds.
So we may want to do this anyway, correct?
Yes.
So we try to see if by putting her in a position of head tilt, chin lift, her breathing becomes less labored or more easier. What does her tag say?
Extensive burns, agonal respirations, soot covered.
Okay, so this person has suffered a very extensive injury. She's covered with burns that may not be compatible with life. As you reach a victim who's older and who's covered with extensive burns, who's inhaled smoke, and is showing agonal respirations. Agonal respirations are respirations that occur right before someone dies from the injury. They are very shallow breathing. They're usually associated with some stridor or a noise, something like that. That means that the smoke has probably caused a lot of swelling inside their trachea, and they're moving air through a very narrow passage. So you're assessing this. Your look, listen, and feel shows that she has very poor respirations. You try to do that, and in the meantime, she stops breathing altogether.
Okay, she's dead.
You will try twice to do a head tilt, chin lift. You will assess her pulse and circulation, and you will find that she is dead. Very good. So you ask your buddy to tag her as black. You move on to the next one.